Hello there, my name is Jasdeep Bara. I'm one of the Emergency Department registrars here at Wexham Park Hospital, part of the Frimley Health Trust. This video today should highlight the essential equipment needed for safe transfers in the emergency department, and also it should be highlighted that this video should be used in conjunction with the safe transfer checklist in Wexham Park Hospital. Many thanks, and I hope you enjoy the video. When thinking about transferring a patient, it is important that 4 essential bits of kit are checked and ready to go at the patient bedside to stop delay of transfer. The first part is the transfer bag.
The transfer bags are located in the drug treatment area in resus, in this corner.
When fetching the transfer bag, it is essential that we ensure that areas are checked and tagged. For example, like this, on the side, you can see that there is this red tag. As we then open the bag, you will also see that all of these bags have individual tags that should be secure and unopened. The second item is the suction.
These are the standard portable suction units in use in Wexham Park Hospital. Before use, it is important that they are tested. Turn the dial to 500 to turn on the suction and to assess whether there is enough battery and that there is some suction here. They should also come equipped with a yanker sucker on the side and some suction tubing, as you can see here.
The third item is some of your monitoring equipment. There are 2 types of monitoring that are employed by Wexham Park Hospital. One is the LifePak 15, and the other is the Fukuda Dynoscope.
Both monitoring and suction is kept in the storeroom at the back of the resus area. As a side note, please ensure that when returning any kit, it is placed back on charge to ensure adequate battery levels for the next users and the next transfers. So similarly to our suction unit, it is important to ensure that your monitoring equipment also has adequate battery life. With the Fukuda Dynoscope, it's worth having a look at the on button, press and hold to turn this on, let it run its checks, and ensure that there is battery life as denoted here. With the LifePak 15, a similar process should be adopted. Turn the LifePak on, allow it to run its self-test, and ensure that both batteries have an adequate supply of power for your transfer.
And the fourth item is oxygen.
Doing checks on your oxygen cylinder, it is essential to first review the valves to show how much oxygen is in the cylinder. Of course, it goes without saying that green is a full canister and adequate for transfer. I think anything beyond is probably inadequate for transfer, and certainly if it is in the red, you should not be using these canisters for transfer. With the canisters that we have, there are 2 oxygen delivery devices. One is via the Strader valve, which will connect to the ventilator, and the other is a flow meter, similar to those wall units, where the flow is controlled at the top by ensuring a clockwise rotation and denoting the litres per minute on this area here. and this is to be used with standard oxygen tubing. As a separate note, it is worth remembering the litres per minute that a patient is getting transferred on. Here you can see that this canister contains 460 litres, and you can use your journey time to work out how long or how many oxygen cylinders that you may need. For example, with a full cylinder and a patient using 15 litres per minute of oxygen, this canister will only last half an hour. It is important, therefore, to remember the amount of total oxygen that you may require for your transfer.
I hope you have enjoyed this video. If there are any further questions, then please don't hesitate to email me on the link below.